your website or social media, email links, if you would like to maybe just say a few words about where you're from so that we can all get a sense of who's here with us today. That would be lovely. Angela, do you think it's just past 10 o'clock? Do you think we should start soon?
We have just 40 people in the room at the moment. I wonder if we could just give it another minute,
okay,
if that's okay. We have had a couple of apologies today, a small handful.
Oh, it's lovely to see everybody introducing themselves in the chat. We've got a really nice mixture of people here today. Some artists, some arts managers, some health professionals, health practitioners. So genuinely bridging the divide. And of course, charity professionals, people from the third sector.
We're still only at 40 participants, but we've got a lot to get through, I know, Jane. So I think we should make a start, and people can carry on joining us.
Yeah,
That's
I think
okay.
So. Let's get started, and if you're okay to keep an eye on the waiting room.
Okay. So Borodar, good morning, everybody. Thank you very much for coming along today. I'd like to say lovely to see you all. Of course, I can't see you, but I know that you're there, and great that you're introducing yourselves in the chat. And as I said, with 100 people, 106 people signed up for today, which I think has to be a record actually for a WAHWN training or networking event. So that's absolutely wonderful. So I think people will continue to be joining us over the next few minutes. So this is the final WAHWN training session in this series, but there will be many, many more over the next year. My name's Angela. For those who don't know me, I coordinate WAHWN, which is the Wales Arts, Health and Wellbeing Network. Many of you, I think, have already signed up to the WAHWN website. Jane's just shared a slide here for me. It's free to join WAHWN. You need to, if you'd like to, you can sign up. You get sent a link, and then once you're registered, you can access all areas of the website. You can upload a member profile so that others in the sector can find you and liaise with you. It's a great way of building collaboration in the sector. Bridging the Divide is the title of today's webinar, and it's really about helping us to have a clearer understanding of terminology and language around the NHS, and helping us to explore what some of the key health priorities are within the NHS. So I'm delighted that we've been able to invite Jane Willis back to devise and deliver the training for us today. Jane founded back in 1994 Vital Arts, which is an arts programme for Bart's Trust. Since that time, she's been Director of Arts and Health Consultancy Willis Newson, and she works with arts and health partners across the UK very extensively. She's worked extensively with WAHWN, helping to support our sector. And yeah, we've had the pleasure of working with her for the last couple of years on training and support, and most recently on helping us to develop the new case study template. So we're also, I'm delighted to say, joined today by some Wales-based contributors. So we have Nhs Lloyd-Jones. Hi, Nhs. Nhs's the Director of Welsh Nhs Confederation. We have Sarah Lloyd, who's Project Coordinator for Age Cymru, and has been heavily involved in the Cartrefi programme. Sarah Goody, who is Arts Development Coordinator for GARS, that's When Arts in Health, and also the Aneurin Bevan University Health Board. Prue Fimbleby will be joining us shortly. Prue is the Arts Coordinator for Swansea Bay University Health Board, and I also have my colleague Tracy Brethnack, who's helping to support. So welcome to all of you, and I'm now going to hand over to Jane.
Thank you, Angela, and hello everybody, Bore da, and welcome. So just a few very quick words of housekeeping. I'm sure most of you are quite familiar with this format by now, but just to let you know, we've got a range of presentations until about 11:45 this morning, but there will be a comfort break, so you will get a chance to go and make a cup of tea about halfway through, somewhere around 10:50, and we are planning to leave some time at the end for questions and discussions. So there is a Q&A function in the webinar, a little button down the bottom that says Q&A. So as we go through, if you have any questions for any of the panelists, if you pop them in the Q&A, then we'll be able to keep an eye on them and bring them into the discussion at the end. But do also use the chat to make more general comments, to keep in touch with each other, maybe to share feedback or to share your own resources or links that might chime with the content of what we're talking about. And just to let you know, finally, that we will be recording the webinar and it will be available on the WAHWN website after today. So if there's anything you want to revisit through the recording, that will be there for you for some time to come. So today's agenda, we have a full agenda as always with these events from WAHWN. We're really going to be exploring the terrain of how the arts meet the health world, and in particular we're going to look at how to understand that terrain, how to understand that divide, so that we can think about how to close it, how to cross it, how to bridge the divide between arts and health. So we'll start with Nhs, who's going to talk to us about the structure of the NHS in Wales. And then I'm going to talk a little bit about what is health, what do we mean by health, and therefore how can we think about how the arts can best meet some of the current health priorities of the NHS in Wales. And then Sarah will share a case study of the Cartrefi project with us. And after the break, I will explore how we might understand the arts and health field, how we might map the different types of activity that happen across the arts and health field. And Prue will share with us some of the work that she's doing in Swansea Bay to address the health needs of that particular locality. And then lastly, Sarah is going to close the webinar by looking at some of the pathways into practice. So for those of you who are new to arts and health, who want to enter this terrain or deepen your engagement with it, I think some of the links and advice Sarah will share will be particularly useful. So that's the map, that's the route we're taking to explore this terrain, and we will start off by introducing Nhs Lloyd-Jones from the Welsh NHS Confederation. Nhs, welcome. I'm so glad you can be with us here today to share some of your insights and to help us understand how the NHS functions.
Brilliant. Thank you, Jane, and thank you, Angela, as well, for inviting me to come and speak to you today. So I'm Nesta, I'm the Assistant Director at the Welsh Nhs Confederation. So the Welsh Nhs Confederation is the membership body for the chairs and the chief executives of all the organisations that make up the NHS in Wales. So my role is very much supporting our members and representing them. So today I'll be touching on both the Welsh Government structures, but also specifically on the NHS in Wales. So first of all, if you go on to the next slide, Jane, that's great, thank you. So in Wales, we've got the Welsh Government and also the Welsh Parliament. So our election is happening on the 6th of May. So it's we're in the pre-election period at the moment. So you won't see many announcements coming out from Welsh Government. But the Welsh Parliament, or the Senedd, is made up of 60 members of the Senedd who will be elected on, like I said, the 6th of May. And then whichever party receives the most votes forms a government. So the Welsh Government and the Welsh Parliament were, devolution happened in 1999. So we're quite a new government, a new parliament, and areas that are devolved are health, education, economic development, transport, environment, agriculture, local government, and some taxes. So quite wide ranging. You know, criminal justice isn't there, but there's a bit of noise around whether criminal justice should also be devolved to the Welsh Parliament. So looking at the NHS structure in Wales, and like I said, we are very lucky that as a Welsh Nhs Confederation, we represent and support all the organisations. So we have 7 health boards, 3 NHS trusts, 2 special health authorities, or 1 at the moment, another one is going to be formed on the 1st of April. And we are the biggest employer in Wales. So the number of people working directly within the NHS is around 100,000 people. But this is probably wider due to the number of people who are commissioned to work for the NHS. So these are people just directly working within the health boards and trusts. And currently the budget for the health and social care is around 50% of the whole of the Welsh Government budget. So the Welsh Government receives their funding from the UK government at the moment. So that's just something to be aware of. So looking now at the 7 health boards, so they are integrated health boards, so they are quite different to the structures in England specifically. So the 7 local health boards provide all healthcare services. So you have primary and community care, so your GP services, NHS dental services, opticians, pharmacy. You've also got mental health services, public health. So in England, public health is run by local authorities, but in Wales, public health is led by health boards. So looking at things like prevention, healthy eating, smoking cessation, looking at loneliness and social isolation, which is becoming more and more of an issue, especially due to the pandemic. Secondary care services, so specifically hospitals and minor injury services. There's specialist services such as major trauma. So Wales now has a major trauma unit since last year in Cardiff. Before, patients from Wales would have had to go to Bristol or to near Liverpool. So Wales now has its own major trauma unit. And also, like I said, services, a lot of services are worked in partnerships, either through commissioning third sector organisations and other organisations to improve physical and mental health outcomes, promoting well-being, reducing health inequalities across the population. So all the health boards are very much accountable to their health, to their population. So Aneurin Bevan, Sarah will be talking later about Gwent. So Aneurin Bevan covered the whole of the population of Gwent, Cardiff and the Vale, Cardiff and the Vale of Glamorgan. And some of the health boards, such as Hywel Dda, work closely with around 6 or 7 local authorities. So there's a lot of integrated working across both the health and social care or local authority partners. So looking at the NHS Trust, so In England, your NHS Trust would be for acute services and mental health services, while in Wales, the NHS Trusts are national organisations that cover the whole of the population. And we have 3 NHS Trusts: Public Health Wales, who are the national public health agency that works to protect and improve health and well-being and reduce health inequalities for the people of Wales. So they've been, in relation to COVID, leading on the COVID response, working with health board partners, also leading on the test, trace, protect system, and also in regards to gathering the information and intelligence around the vaccination programme. We've then got Valindra University NHS Trust. So I think a lot of people are aware of the cancer centre that Valindra has. So they provide specialist cancer services across South and Mid Wales through the cancer centre, but they also run the Welsh Blood Service as well. And then finally, the Welsh Ambulance Services NHS Trust. So the ambulance service covers, again, the whole of Wales and provides a range of out-of-hospital emergency and non-emergency services. So they're doing quite a lot, working with community transport at the moment to ensure that people can access their vaccine appointments. So they're very much leading on that, the community transport response in Wales at the moment. So the special health authorities in Wales, so we've currently got one, and like I said, the next one, Digital Health and Care, will be established on the 1st of April. So Health Education Improvement Wales was established in October 2018, so quite a new organisation, but their profile is rising all the time. And they're leading on education, training, development, and shaping the future workforce across Wales. They published a workforce strategy, future workforce strategy, with Social Care Wales last year. And interestingly, the strategy looks at both NHS and social care staff, but also looks at the role that third sector, unpaid carers and others have to support the workforce of health and social care in the future. So very much recognising how the third sector and others provide a massive contribution to the health and care system. The Digital Health and Care Wales, like I said, will be established on the 1st of April. They will be leading on digital platforms, systems, services, and collecting and analysing health service data. So, for example, with COVID, they're the ones leading on the number of people who have had the vaccination, so collecting that data, looking at how many people haven't turned up for appointments, and they also develop a lot of the platforms within the NHS. So, for example, the rollout of MS Teams. So, how social care is delivered is very, very different. Like with the rest of the UK, local authorities have the statutory responsibility for planning and commissioning social care services, as well as duty to safeguard individuals. So in Wales, we've got 22 local authorities, and they provide direct care, but they also commission services from private or voluntary sector organisations. So the running of, say, care homes and other support services. Integration, and I know Jane will be touching on this, it's over the last 5 to 6 years, there's been a significant amount of integration of services between health and social care. And it's very much now the expectation that the NHS and social care, when developing new services or looking at services that they currently run, looking at how they can work closer together with local authority partners to deliver services and that matter really to their populations and the outcomes that really matter to people. The Social Services and Wellbeing Act provides the legal framework for improving the well-being of people who need care and support unpaid carers. And they introduced regional partnership boards. So this is a structure where health, social care and housing come together to look at how they can support the well-being of their local populations. I've mentioned Social Services and Wellbeing Act. The other key legislation in Wales that's really driving the partnership working, the integration working is the Wellbeing of Future Generations Act, which was passed in 2015 and it came into force in 2016. So quite a new piece of legislation, but it's very much innovative. It's the first of its kind in the world. New Zealand are following Wales's example and are introducing similar wellbeing legislation. So there is a duty on 44 public bodies, including NHS organisations and the Arts Council of Wales and local authorities, to work in partnership to set up wellbeing objectives and to look at the current and future generations. And it's very much working together to look at things like a healthier Wales, a more sustainable Wales, a more equal Wales. And so there are 7 wellbeing goals that all those public bodies, 44 of them, have to consider. Anything that they're introducing or any of their work, they have to consider it through the lens of the wellbeing goals and the wellbeing principles. And that has led to, you know, again, increased partnership working. So just personally talking about the Welsh NHS Confederation, as a result of the Wellbeing of Future Generations Act and the legislative context around it, it led to us to work very closely with the Arts Council of Wales, following work that they've been doing with individual health boards. It was felt that at a national level, the Welsh NHS Confederation had a role to raise awareness of how the arts could benefit health and well-being of the population. So we signed our first MOU in September 2017, and we've just signed our second MOU. So the lovely infographic that you can see there that we had done just to highlight what had been achieved in the first 3 years. So it was around how we work together with WAHWN and the arts coordinators and artists around raising awareness of arts and health, the training and networking opportunities that Angela's highlighted, through innovation and good practice, and also through sharing of information. I think that's, you know, key for us in Wales, is that if there is something that's happening well and it's, you know, embedded and it's making a difference, then how can that be, you know, scaled up or learnt from other organisations across Wales? So that's something that, you know, it's always being looked at, and there are many examples around how that is being done. So that's just a very brief overview of the structures and the context that I know Jane will be now providing a little bit more detail on.
Nesta, thank you for that incredible sweep of the terrain and looking at how the health sector functions in Wales. And there are some key themes in there that we're going to pick up on throughout the rest of the morning. Themes around particularly integration, partnership working, and the way in which health has become quite a complex thing to address and tackle, and how an integrated approach to that is really vital. And I think the other thing I'm taking away from your presentation, particularly the last 2 slides, is this idea that perhaps the ground is now ready for arts approaches to flourish. It feels like there's a real fertile ground in which to, you know, plant the work that we are all doing in the arts and health sector, so that can propagate and grow. But I want to now just take us to go a bit deeper, I suppose, into that landscape and have a closer look at some terminology. And I thought I would start by asking, what do we mean by health? What is health? We talk about health as if we're really clear about what it is and about what it looks like. But I think it's actually quite helpful for us to perhaps understand some of the historic changes that there have been over the last 40 years or so around our understanding of this word health. So back in 1948, at the time of the birth of the NHS, the World Health Organization came up with this definition of health, that it is a complete state of physical, mental and social well-being, and not merely the absence of disease or infirmity. So that's a really broad, inclusive and holistic concept that health is actually a complete state of physical, mental and social well-being. And I think in some ways that statement was well ahead of its time, because actually what followed in, you know, the last, I don't know, 40 years or so was not so much that holistic view of what health is, but really quite a medicalized view of health, I think, took root within the health services across the UK as a whole. And so, it's really, I think, helpful to think about what the medical model of health is and how this has changed over time. So the medical model, some of you might recognize some of these ideas and might recognize how much they have changed in recent years. So first of all, it's underpinned by the idea that the mind and body are separate, mind-body dualism, but they're separate and distinct, and that we can treat physical ill health without considering mental well-being because the two are separate. Whereas these days, I think most people would fundamentally disagree with that in most aspects of health and well-being. The medical model of health was really underpinned by an idea of a mechanical metaphor of health, and that the body was imagined as if it were a machine that could be fixed. And I think we now think quite differently about the complex way in which the body works, not as a mechanical machine, but as a complex interplay of, well, as the World Health Organization said, mental, emotional, social and physical aspects. There was a technological imperative underpinning many approaches, not all approaches, but many approaches to health. And the idea that we should use all technology available to do everything possible to extend life and prolong the inevitability of death. Whereas I think recently we've seen the rise of disciplines like palliative care really challenge this, and much more emphasis on quality of life rather than just length of life. Fourthly, a reductionist approach to health, the idea that if you broke down or reduced complex biological or medical phenomena into their composite parts, you would be able to understand a single cause, you'd be able to chase it back to a cause and be better able to devise a cure. Whereas I think now we're realizing the absolute complexity of many health conditions. And lastly, the doctrine of specific aetology, which really links to that, the idea that there is always a specific cause to an illness or a condition. And these days we're seeing the rise of many conditions that the medical profession would confess they don't really understand the cause of. So for a long time, this medical model underpinned our approaches to health, but really we're seeing that change rather dramatically. And one way in which we can see this shift happening is the language that's being used in the health sector and in the way we talk about health. So more and more, we are not talking about disease, and we are more talking about health. So we're more embracing that early concept from the World Health Organization of a holistic view of health. More and more, we are shifting the focus of health from hospital into the community. We are looking at how we can support health, not just by treating people in hospital, but by supporting people in a whole range of ways in the places in which they live. Likewise, there's been a shift in focus from acute medicine. So the idea that you might have an episode of illness or ill health or an acute health problem that can be fixed and treated. And more we're looking at a range of chronic conditions, conditions that perhaps can't be treated or resolved or got rid of, but that merely we can help people live well with them, live the best they can with them. So less and less, perhaps, we're thinking not in terms of cure, but in terms of prevention. And also, rather than intervention, we're thinking about monitoring, we're thinking, we can see this in relation to the approaches to the pandemic, you know, monitoring the number of cases, monitoring the number of deaths, and thinking about prevention alongside cure. So rather than treatment, we're hearing the word care more and more expressed. I mean, I started working in arts and health, I think about 27, 28 years ago, and I can tell you care was not a word that was commonly used in the health service. It wasn't part of the vocabulary in the way that it is today. And likewise, we are thinking less in terms of patients to be treated and more in terms of the whole person looking after people. So there's a real shift in the way in which we are thinking about health. The whole concept of health is changing. And perhaps one of the key concepts that underpins this change is the idea of the social determinants of health, which has been pioneered in particular by Sir Michael Marmot. So this is the idea that health is determined partly as a result of social and economic circumstances. Poor health doesn't just happen as a thunderbolt out of the blue, but it is actually often determined by the social and economic circumstances in which people live. So the key social determinants of health are education and employment opportunities, the quality of housing in which we live, the richness of the social networks that we belong to, and the environment in which we live in terms of the extent that it might facilitate exercise or a good diet or social connection. So there's really an increased understanding that these mechanisms, these social determinants, impact mental and physical health. And the way in which this happens is complex, that things are interrelated, and they often happen over a long period of time. And lastly, I'm sure it's not going to be a surprise to any of us here today, but there's a social gradient that impacts these determinants. So poorer individuals are experiencing worse health outcomes than people who are better off. And this can be expressed in this, this kind of visual diagram where you can see how these layers impact one on top of the other, and how there's a complex dynamic that operates between them. So you have the individual person at the center, age, sex, constitutional factors which relate to the individual that will be impacted by individual lifestyle factors, how we choose to live, the habits that we form over our individual lives. But indeed, those lifestyle factors aren't just a matter of individual choice and determination, but they are impacted by the networks, the social and communities in which we live, which in turn are affected by these wider determinants like housing, unemployment, living conditions, working environments, education, and so on and so forth. So I think that it is really important for us to bear in mind these wider shifts and changes in relation to health when we are thinking about how the arts can be used to support the health of the nation. And it's important to think about how these wider shifts in how we understand health have led, in fact, to whole changes in the way in which the health system is structured and the way in which healthcare partners are addressing the challenges of today's population. I think we now understand the medical model is not fit for the future. The types of conditions that the health sector is trying to address in terms of supporting our health and well-being can't be fixed and treated, but actually we have to really understand those wider determinants of health, and we have to think creatively about how we can help tackle some of those wider social and economic factors which influence health. So in terms of arts and health, I think understanding that arts and health doesn't just happen in hospitals, but actually integrated healthcare systems mean that there's a role for us to think about how we can use the arts to support health and well-being in the wider community, how we can use the arts to think about prevention and self-care, as well as support and treatment of health conditions is really key for all of those of us who might be arts practitioners. So I thought I would just finish before I hand over to our next speaker by looking in a little bit more detail about what some of these key health needs, health priorities might be at the moment, and how the arts are beginning to think about how to support and address them. So COVID-19 obviously is the key, the major health issue these days. But alongside COVID-19 is what I've heard called the mirror pandemic. So the pandemic of mental health, of trauma, anxiety, depression, and loneliness, which is, you know, impacting all of us, but in different ways and to different degrees. How can the arts support this mirror pandemic that's happening? We're seeing a lot of work taking place around that. But not just now, not just during COVID-19, has mental health been a key priority for the health sector. But mental health was a priority even before the pandemic, and it will continue, I think, to be a priority for a long time afterwards. A priority for the wider population in terms of the levels of anxiety and depression. And we see this in the fact that workforce wellbeing is also a health priority at the moment and will continue to be, but also particularly a priority for young people, young people's mental health. Another priority, as Nesta mentioned, is isolation and loneliness. So social isolation, but also rural isolation, and we'll have a little look at what that means in a second. But also lifestyle conditions, as I've mentioned, and these might relate to individual choices, but individual choices that are very much informed and affected by those wider social determinants, and chronic conditions which might well be influenced by social determinants, and that are conditions that can't always be cured, only controlled, and yet have a seriously limiting impact on the quality of our lives. So supporting chronic conditions and enabling individuals to support themselves, to live well, to live better with chronic conditions is a key priority, as is supporting an increasingly aging population. So one key document that I want to point to you towards in relation to, if you want to understand more about the impact that the arts is having in supporting health, is this World Health Organization evidence report that was published, I was going to say last year, but actually I think it was 2019. And it is a comprehensive overview of the findings from 3,500 studies looking at the impact that the arts plays globally on supporting health. But it certainly talks to many of those priorities that we've outlined for Wales. It looks at the way in which the arts is addressing physiological outcomes, how it's impacting and supporting our physical health, but also how it's supporting psychological outcomes. So how it might be reducing anxiety or enabling connection or increasing self-esteem. But also it's looking at how the arts is impacting social outcomes. And as we've seen, those three are all complex and interconnected. So let's have a quick look at how we might be addressing some of these things through the arts. So COVID-19 is a key health priority, obviously, for the health service at the moment, and one might think that the arts can do nothing to address this. The arts cannot devise and deliver a vaccine, and yet there are projects where their artists are being employed to devise campaigns to support the uptake of the vaccine. Artists are being employed to work, for example, exploring the mental health experiences of local Black, Asian and minority ethnic communities in relation to the pandemic and how it's impacting particular groups' mental health and the challenges they face. So even in direct relation to COVID-19, there is a role for the arts. But particularly we're seeing the arts play a role in relation to this idea of the mirror pandemic. The arts are currently being used in a widespread way to help address anxiety, depression, trauma, to support isolation and loneliness. We're seeing lots of organisations on the ground delivering remote art packs, delivering online creative activities. We are seeing museums and galleries using their archives to devise programmes to reach people at home who are shielding. And as you can see here, addressing loneliness is really key and really important, because loneliness before the pandemic and during the pandemic and after the pandemic is as big a killer, if not a bigger killer, than obesity and as dangerous as heavy smoking. So it's a really key issue for us to address, not just psychologically and emotionally, but physically as well. Arts activities are being used to address loneliness because they help create connection and meaningful relationships. They help build self-esteem. They deliver enjoyment. They enable people to develop a relationship with themselves, which is a key precursor to developing a relationship with others. And they act as a catalyst for the imagination, which helps us to connect with the wider world, even when we're alone. The arts are key in addressing mental health alongside that, addressing stigma, supporting, for example, veterans' mental health, supporting maternal mental health. The arts are being used to address workforce well-being in working age adults, but also to look at the way that work can be damaging to health as well as beneficial to health. And during the pandemic, we're seeing a number of projects that are particularly looking at supporting the health of NHS employees. For example, Claude Ensemble's Performing Medicine Circle of Care, and I know Prue, you've been working with them, have also developed programs around supporting NHS staff to cope with wearing PPE, for example. Lifestyle conditions, self-management of chronic conditions. There is a key role for the arts to look at how to support people to live well with a number of debilitating conditions, either by addressing their health needs physically or emotionally. So singing for lung health and singing for breathing does both. It addresses lung capacity and lung strength, but also builds connection and enjoyment, as do programs like Dance for Parkinson's or Dance for Stroke Rehab, and are a number of burgeoning arts on prescription programs. And as we all know, the arts have long been a source of support and succor for a whole range of challenges that the ageing community face, not just around isolation, loneliness and dementia, but also physical conditions that come with old age. So on that note, I am delighted now to hand over to Sarah Lord, who's going to look in more detail about the challenges of our older population, and one project in particular that Sarah's been working on that addresses the well-being of residents in care homes. So Sarah, welcome. Thank you very much. I'll hand over to you to share your screen.
Thank you for having me. It's great to be here. I'll just bring this up. So yeah, I'm Sarah Lord, and I run the Cartrefi project, which is Age Cymru's Arts and Care Homes project. So to start off, rather than just listening to me talk all the way through, I'm just going to play a short video which explains every stage of Cartrefi, but it also goes into our most recent findings, which is the project social return on investment. So I'll just play that now.
It's estimated that 80% of people in a care home are living with dementia. In 2013, the Alzheimer's Society surveyed relatives of care home residents, and it was found that less than half felt that their family member was being offered opportunities for activities. In April 2015, the Cartrefi programme was developed by Age Cymru. The purpose of the programme was to increase opportunities for residents and staff to participate in the arts, and to develop and mentor artists to deliver sessions for older people in care settings. Age Cymru recruited professional artists in Wales, who were then supported by experienced mentors, delivering weekly participatory creative sessions with residents, staff and family members over 8 to 12 weeks, inspiring and reigniting a passion for creativity. The first phase of the project ran between 2015 and 2017. Phase 2 between 2017 and 2019, with the current phase running from September 2019 to the end of August 2021. 3,217 residential and nursing care home residents, staff, volunteers and family members in 194 care homes have participated since the beginning of the programme. An independent evaluation of the first phase by Dementia Services Development Centre Wales at Bangor University found that the programme had a significant impact on older people's well-being, as well as staff attitudes towards residents, especially those living with dementia. Staff gained the confidence to lead creative activities themselves and were more likely to seek out cultural experiences outside of work. While this evaluation provided strong evidence of the impact of Cartrefi, it was felt that an SROI analysis would provide further evidence on the social value generated. An SROI analysis collects information to tell the story of how change is being created by measuring social, environmental and economic outcomes, and uses monetary values to represent them. From this analysis, it was discovered that Cartrefi delivers a social value of between £4.53 and £9.08 for every pound of investment. Based on rigorous evaluation and assumptions based on previous research, the estimated social return on investment is £6.48 for every pound invested during the first 2 years. The legacy of Cartrefi in the care homes goes beyond an increased appreciation of the arts and into fundamental elements of person-centred care. Staff spoke about how the sessions had improved their relationships with residents. Cartrefi has also influenced artists' own practice and resulted in several short films, sound recordings, and touring visual art exhibitions. Overall, the Cartrefi programme has very real social value and continues to have a positive impact on the social care sector. The Cartrefi programme is delivered by Age Cymru and funded by the Bearing Foundation and the Arts Council of Wales.
Okay, so obviously the video covered really a lot of phase 1 and phase 2, but just to explain a little bit about where we are at the moment within the third phase. So we're looking at the sustainability of the project. So we're looking to empower care home staff to improve the range and quality of creative provision in their care home through activity plans and care home workshops. So the care home workshops are where we bring care homes together to work together and where our artists share tried and tested creative sessions for the care homes to practice together, but also then take back into their own homes. And then the activity plans are one-on-one sessions between one of the artists and a care home, looking to develop a sustainable activity plan, which is tailor-made for the needs of that home. We're also looking to build capacity by sharing learning through the arts sector through our artist workshops. So these workshops are where two of our artists share their experience and the workshops that they've run within care homes as well, with other artists and creatives across Wales who are interested in working within care homes with care home residents. With the impact of COVID, obviously these workshops were taking place in person before, but knowing that how important it was to keep supporting the care homes, we have been able to take these online. So all of the workshops have been continuing to be delivered online. We wanted to make sure that, of course, that you know, with creativity, enabling people to express themselves, and when more important than now, during a time where they weren't able to you know, see loved ones and family members and everything, and also offer a bit of fun for everybody involved. So for the care staff as well, to have something rather than just their normal work routine. We also look to raise public awareness of the benefits of creativity in care homes through our exhibitions and sharing findings. And then we also have the Kest Masters of Research project, which is happening, run by Bangor University, looking to how to shape the project going into the future then. So how we can continue to support care homes in the future and ensuring that we are meeting the well-being needs of the staff and the residents. Oh, okay, so mentioned it in the little video that I showed was the evaluation. So this is just looking at the impact on the care staff. So there was a statistically significant improvement in attitudes towards residents, especially those living with dementia, and a significant increase in confidence to lead a creative art session in the home. Residents themselves rated the sessions 86%, rated 86% of sessions as highly enjoyable, so 4 or 5 on a 5-point scale. But we saw, you know, other impacts such as socializing more and even regaining skills such as managing to start using a knife and fork again. And a statistically significant improvement in well-being scores after attending the Cartrefi sessions. So during phase 2, we did a feedback survey, and from the homes that responded to that, 100% of them reported that their Cartrefi residency was a positive experience, and the same 100% reported that they've continued to run creative sessions after their Cartrefi residency, which we really couldn't ask for more than that. And then during phase 3, our feedback to date, so 100% of the care home workers have responded that they feel more confident in delivering creative sessions themselves after joining our workshops or working on an activity plan. And 100% responded that they would use the ideas shared by our artists within their own home. And many of the homes that we work with attend more than one workshop, which is great. They continue to come back. So we've tried to keep this care home, our relationship with the care homes alive, but we always, through each phase, we leave the application process open so care homes can continue to apply to be part of Cartrefi. It's not just right at the beginning. And we also send out regular newsletters, invitations to all our opportunities, requests for feedback, and we've also recently developed a brand new website and a community forum as well, which we hope to grow now where artists and care home workers can actually join and talk together and share and things like that. So we're hoping that that's going to really take off. Okay, so for the artists, the support and the training, sort of mentoring system. So the whole team received dementia training were briefed really on what it would be like to work within the care homes. And then all of the artists worked under artist mentors. One of them is actually on the panel today, Prue. She was one of the mentors from phase 1. And then going into phase 3, all of the artists are artists from either phase 1 or phase 2. So they've worked on the project for between 3.5 to 5.5 years. So they've got a huge wealth of knowledge and experience, and of course continue to receive support throughout the project. And then in regards to other artists outside of the Cartrefi team, of course, we're running these creative workshops to help support those who are looking to work with residents within a care home. Okay, so the impact and the legacy for the artists. So from the evaluation, we found out that there was a statistically significant improvement in attitudes, including hope and recognition of personhood towards residents, and personal development and the development of new skills for all of the artists that have worked on the project. And phase 3, so 60% of the artists and creatives who have attended our workshops have asked to be added to our database of artists available to work with our care home network. We think that's slightly lower because in the beginning, of course, it was paper that they could fill it in, whereas now it's emails afterwards and then sending things back. So yeah, it's slightly lower of the 60% of those than we'd expect. And then most of the Cartrefi artists, past and present, continue with it, working within the sector outside of the project, as well as during their time on the project. So these are just some quotes that I wanted to share with you. These are all really based around the residents. So from phase 2 of the project, these are from. So I do so love you coming in to make things with us. It gives me something to think about. This has been the best day I've had for years. I had no idea that I could actually do something like this. I don't want her to go. Sandra was also using the pencil on her own, which was amazing to see. The staff had never seen this before. She told me that Chris has been very poorly for a few months. I mean, really poorly. She has been in hospital a lot, and she said she had had enough and was ready for death. Today is the first time I've seen her smile in such a long time. That photo you took, it really captured her sparkle, and it was so good to see her having fun and looking herself again, which is just lovely that the artists have had this impact. And then just a couple from our more recent workshops that we've run. So fantastic insight into creative activities in care homes. They were very welcoming, creative, willing to share, help, and go on to discuss in-depth tangents based on real experience, a great help for me to expand. Fantastic day with a huge wealth of information and lush people, thank you. The workshop was great, loved the variety of ideas and to be shown exactly how to do things. It was a very good workshop and can see it benefiting our residents. Can't wait to use the tools I've learned, thank you. And then finally, this is a quote from one of the phase 2 reflective journals. So the artist would complete a reflective journal after each session within the home, and they continue to do that. And the lady that's being spoken about in this quote is a lady that I met myself when I visited the artist within the home that she was working in. It was only her second session with the home, but I sat with Anne for the 2 hours that I was there. And couldn't speak, but she would smile a lot and she was holding my hand, and the artist had brought in tactile items for Anne to work with, and she was more than happy to do that. But reading this reflection really showed the impact that the artist had throughout the weeks of her work in there. So there are so many wonderful, special moments when I spend time with people in a care home. Today, Anne, who has severe dementia, and who I have been working with for the past few sessions, was having a good day, and she talked to me properly for the first time. And rather than just see the sparkle in her eye and the smile, she could connect with words too. Looking through pictures of her family as a child and drawing a line on a page, a big achievement for her. And that, I just find it so impactful that it really is, it's never too late to get in there and try and make a difference, and it really can help to prevent, you know, things getting worse, really. And so yeah, that's all from me. I know we're going to have a Q&A session later, so if anybody has got anything to ask, but I'll stop sharing my screen now.
Unmute myself. Wonderful, wonderful. Thank you so much, Sarah, for sharing that. I particularly loved that picture of the astronauts. I thought that was gorgeous. And I think what's really interesting about this project is that it's very clearly addressing the needs of older people in care homes. It's very clearly thinking about them first and foremost. It's very clearly working in partnership with the care homes. And it has a really strong evaluation behind it, looking at being able to quantify some of those benefits. But I think what's interesting about it is it's also addressing the need for system change. So it's thinking about how to support the people working in the care homes, as well as bringing activities in, how to support the culture of care that is grown and developed within care homes, but also sustainability in terms of how to support artists, how to skill and equip artists, not just to work with you in the future, but to work in a range of other settings. And I think those are really key, important things for us to think about in how we develop programs in the future. So it is 11 o'clock. It is about 1 minute past 11, I think. So I think it's time for us to take a break from the screen. I suggest that we meet back here at 10 past, if that's okay with everybody. We'll start bang on 10 past. So if you want to get back a minute before then, that would be great. But go and roll your shoulders, stretch, look out of the window, put the kettle on, do what you need to do to refresh yourself before we come back to our screens again. So I look forward to seeing you at 10 past. Thank you, everybody. So, welcome back. The funny thing about a webinar is you can't see if people are here. So I'm going to assume that most people are, and just move on to our next session. So I thought it would be helpful to have a look at trying to map the arts and health field. And having decided that I would try and do that, I realised it's an almost impossible thing to do. But we've looked at the health sector, we've mapped out how the health sector is structured, we've looked at the different aspects of health and well-being and how the arts might support current health priorities. And then we've looked in depth and in detail through the Cartrevi project at how the arts are supporting older people in care homes. But I think for anyone working in this sector or wanting to work in this sector, a key issue is how do you find your place? How do you find where you should be in relation to the different health needs or the different areas of the health sector or the types of work that are taking place? Because it's really a broad and diverse sector of work at the moment. And as we will see in a minute, it takes place in different settings for different reasons in partnership with different organisations. So I thought if we could try and just explore that map a little bit, it might help you think about where your skills, where your enthusiasm, where your abilities might best fit. And that might help you to think how to connect your practice with health and well-being. So the first document I want to point you towards, which I think is a really brilliant starting point for anyone wanting to understand arts, health and wellbeing across Wales, is this mapping study that was commissioned by Arts Council Wales. It was carried out between 2016 and 2018 and published at the beginning of 2018. So it's a couple of years out of date, but it is still very relevant, and it gives a really good snapshot, a really good overview of the principal arts and health activities and taking place across Wales. It looks at activities, it looks at case studies of practice, but it's a really good document to go to also get a sense of the people working in the sector, the expertise across the sector, as well as the work on the ground. And it was commissioned in particular to inform strategic decisions around arts and health practice, and in particular for Arts Council Wales to support them in considering how best to invest energy and resources so that the arts can make a greater contribution to health and wellbeing across Wales. So it's a really good starting point for thinking about how to map this sector and how to map the way in which it connects to health and well-being. But it doesn't actually offer us a map. It doesn't actually offer us a structure or a typology of the type of work that's taking place. So that's what I was trying to think about. What would that look like? So obviously, we can look at arts, health and wellbeing work through a range of different lenses. And one of those could be art form. So if you're an arts practitioner, if you're a creative and artist, then where your work fits might depend on the art form that you practice. Whether you're a filmmaker or a writer, whether you're a choir leader, a photographer, whether you work in theatre or the visual arts, arts, health and wellbeing encompasses just about every art form. And this honeycomb, I think, could extend. I'm sure I haven't captured every single art form on there. So one way to think about it is the art form and where that best fits in relation to different types of health and wellbeing needs. But that doesn't take us very far, really. I think another way of looking at it could be thinking about where the activity takes place. And that's really broad, diverse and wide as well. So in terms of secondary care, it happens in hospitals, in mental health settings, as well as acute hospitals, in primary care. It happens in GP surgeries, but also through primary care projects around social prescribing. It might be happening in day centres or homes or arts venues, community centres, libraries. Arts, health and wellbeing activity is being delivered by third sector organisations, by housing associations, obviously in care homes, as we've just seen, as well as arts venues. Museums are now becoming more and more involved in arts, health and wellbeing work. Education settings, schools, universities, not just through teaching and research, but actually supporting young people through arts, health and wellbeing programs being delivered in schools or in partnership with schools. And obviously at the moment online, a lot of work is happening online. So, you know, that again is not a simple model, it's a complex model. Because often what we're getting is primary care working in partnership with community organisations, or museums working in partnership with hospitals or GP surgeries. But it gives you some sense of the breadth. Arts, health and wellbeing isn't just about working in healthcare settings. It's about work that takes place in a whole range of settings that's around supporting arts, health and wellbeing. So I just experimented with another way of mapping or thinking about this sector in relation to the impact it has, the outcomes or the way of working. So there's work that's taking place within healthcare settings that's about enhancing healthcare environments. As we heard when we looked at the social determinants of health, the environment in which you live, in which you work, impacts your experience of day-to-day living. And nowhere is this more true than for staff and patients in hospitals and GP surgeries. So there's lots of work that's about physically enhancing healthcare environments. But that work might also extend to arts projects that support physical health in hospitals. So encouraging people in trauma and orthopedic wards perhaps to start to move, start to exercise, giving them the motivation to walk as they're recovering from surgery. It might be about supporting people's mental health and well-being, providing distraction, engagement, creativity. It might be about enabling expression, improving quality of life. And those sorts of things might happen not just in healthcare settings, but in homes and communities around reducing loneliness and isolation. Arts on prescription, I think, is a big area of development across Wales, across the UK as a whole, but I think something that we will see grow and develop across Wales. And that is about the therapeutic use of the arts to support people who are struggling with ill health, who are struggling with maybe depression, anxiety, loneliness, a whole host of things. So the arts used therapeutically to support health and well-being, as distinct from the art therapies. So I've included the art therapies in this map here, but I've included them as distinct from the therapeutic use of the arts. My distinction, the one I use, is that an art therapist is somebody who is clinically trained and works as part of treating a patient for whatever the well-being need is. So it's about somebody who's clinically trained, works within a clinical model of diagnosis and treatment. Whereas the therapeutic use of the arts is much more broader. It's much more based on the artist being in a more equal relationship with the person or the group that they're working with. It's not a model of diagnosis, treatment and cure. And therapeutically, the arts are used to support mental health and improve staff well-being, but also in terms of education, the arts are used within medical education to support a broader broader training of medical professionals to give them the really wide range of aptitudes and skills to work in the health sector. And that includes the use of the humanities within health and medicine. So we could map it according to the reason that we're doing the work, or the setting in which we're carrying out work. Or we could think simply about the way the arts are used across the life stages, which is the approach that in England, the All-Party Parliamentary Group on Arts, Health and Wellbeing took in their report Creative Health, where they used the lens of life stages to look at how the arts are used to support people. But what I found when I tried to do this, as you can see, is it's really not simple. There is no one easy way to really map and categorize the way in which we work with arts and health and well-being. So I find myself actually returning to some work carried out back in 2001. So we're going back 20 years now, by an artist and researcher called John Angus. And John Angus came up with this diagram which maps the key dimensions of arts and health. And I think there are aspects of it which could do with updating, but I think it still works really well to map the way in which the arts are being used in different ways to address both community and individual health and well-being. So this diamond has, if you like, 4 quadrants to it. The way in which art is being used to support the individual, to support individual well-being, ways in which art is being used to support social well-being, with the idea that good relationships are a major determinant of health, the way in which arts are being used to engage groups, to work socially in communities to support health services, and the way in which the arts are being used to support individuals through the health services. So let me try and open up and unpack John Angus's map a little more to actually look at it in practice. So I think what he's saying is the arts are used to support individual well-being. So the idea behind this is that creative expression is intrinsically healthy. It supports us to flourish. It supports all of us to flourish. And part of that is about aiding expression, which is central to health. The arts are therapeutic and can be used to support individual well-being through both the therapeutic use of the arts and through art therapies, as I was saying. But more than this, the arts are used to build social connection. So arts within the social context, the community context, to build connection, and through that to alleviate loneliness and isolation, which are other major determinants of health and well-being. That used socially, the arts can strengthen relationships, produce positive social experiences, and we see that through the burgeoning practice of social prescribing and arts on prescription, but we also see that in the art sector through the way in which socially engaged practice works through community arts. So I think, you know, where arts, health and well-being stops and socially engaged practice and community art starts is a very blurred line. They're very interconnected in terms of arts and social connection. And then Angus looks at the way in which the arts are used to support social connection, which supports the delivery of health services. And in particular for him, this is around the arts being used to support health education, health promotion. So maybe using the arts to develop more engaging information about health for communities, about health services. And the image on the right is one of a series of posters that Angus designed here about lung health and breathing. And if you remember earlier, the example I gave of the way in which artists are being used today, currently, to produce health information to support people to go and be vaccinated during the pandemic. But also the way in which creative activities can be used to influence health behaviour, about group, communal, community-based activities such as lantern parades in communities to raise awareness and explore health issues. And lastly, Angus looks at the ways in which the arts are supporting the individual within the delivery of health services, which might ease the burden on staff, which might be through improving health environments, or which might be through projects that support specific health conditions. So rather than support people generally through health and well-being, that support specific health conditions. So yes, I'm not sure whether that's helpful at all. I've kind of offered you a series of lenses through which to view arts, health and well-being, through your art form and practice to see where that might best dovetail and fit with a range of health conditions, through the types of outcome that we're seeking to support within health and well-being, or through Angus's diamond in relation to supporting individual well-being or social well-being, supporting health and well-being through the health services or through community settings. But hopefully it might give you some insight into where you fit. But another way of seeing where your work might fit is to see what's actually happening on the ground. And so I'm really delighted to introduce Prue Thimbleby from Swansea Bay Health Board, who's going to look at how you are actually supporting the health and well-being of your community there in Swansea Bay. So I'll hand over to you, Prue. Thank you.
Thanks, Jane. So here we go. You see that, everybody? Yeah. I'm one of 6 arts coordinators across Wales. In 6 of the 7 health boards have art coordinators now, and Sarah Goody, who's here today, is arts coordinator in an Arran Bevan Health Board. I see our role as being gardeners to grow arts within the health service. And health boards in Wales, we look after all the health for the whole of the population in our area. So that encompasses everything from public health and working on the streets, in housing, in care homes, to working in intensive care units in hospitals. So it's a wonderful job, my absolute dream job. And I also see our role as being a bridge, but more of that later. So I've been asked to give you some examples of what's happening in projects in Swansea Bay Health Board, and they'll be similar to projects that are happening in health boards across Wales. When you think of the health in arts, probably one of the first things you think of is arts in the environment and new builds, refurbishments, capital projects. In Swansea Bay, we're lucky enough that we have a policy of 1% for art, and we have a fantastic capital arts manager who leads on all our arts in the environment projects. And this is her talking about a project, recent project at the beginning of the pandemic. Whoops, come back. If it will play. Yes.
It began with me sitting on a garden wall 2 meters away from Marcus, the project manager of one of the field hospitals. And he said that he'd had a very specific request from the nursing team to create spaces in the field hospitals that would offer support for their staff and that would also send a really clear message to the loved ones of those patients that were being cared for in the field hospitals, that they were being looked after with respect and compassion and dignity. At the very same time, the chaplaincy had contacted the arts and health team saying that they also wanted to support staff by creating spaces for prayer as well as contemplation in each of the field hospitals. So places where staff could go to step away from all of the intensity and the emotional difficulty of working in this current situation. I was looking for artists that could really step up where there's very little time and create a dialogue between myself, the artist, and the nursing team so that something could grow out of it very quickly. And the nursing staff, they chose a series of bilingual words, and also they selected phrases from 2 poems that they wanted to include on the space that staff walk along with those patients that have sadly passed away. I just feel humbled by the whole experience of working with the team. It's been an incredible project to work on.
Thanks, and that was Heather Parnell, who many of you will know. So a completely different project now, Digital Patient Stories. So I was appointed as Arts Coordinator in 2012. And the first thing I did was look around the health board and listened to what was happening, to what people wanted. They hadn't had an arts program before. This was completely new, and many people were unsure as to what it involved. So I realized that my skills as a digital storyteller were going to be useful, and that staff within the health service would really understand what this project was about, because health staff, above everything else, love to hear from their patients, and they really care about what their patients think and what they experience. So I started to make digital patient stories. Now, for those of you who don't know about digital stories, they're an edited voice recording put together with photos or drawings. They're always first person, they're always short, and the patient keeps control of their dialogue. It's not edited for them. They're in control as much as possible. So this is a very different project, and it really touches on such a lot of service improvement within the health board, because I work very closely with serious complaints, helping patients to have their voice heard through this methodology. And I'm going to play you a story now, a little bit critical of the health board, but was massively important in changing behaviour just partway through the pandemic, when masks were just being advised to come in. And we made this story and played it to our staff across the internet. And some people were resistant to it, but actually Swansea Bay has had a really good drop in in-hospital infection. And I like to think that this story was a little bit to do with that. So this is the story, just as by an example. Oh, done it again. Let's see. Yeah.
I walked from the car in the fresh air without a mask on, and before I got to the sliding doors, I put my mask on. I've been shielding. I'm a bit nervous about going into a centre which cures people of COVID. I went in, I joined the queue to see the receptionist, who was very helpful, who told me to go and sit down in the relevant waiting area, which I did. I walked past half a dozen nurses within the corridor, and they were tight, and I couldn't avoid them. I was a bit worried about opening doors. Some doors you can push, some there are handles on, and I held a door open for somebody else, a member of staff who didn't have a mask, and they went through, and I'm happy to hold open the door to reduce the contamination people have. I try to be aware of the risks of COVID and the values of social distancing and masks and washing our hands and so on. And being in a hospital, I thought best practice would be everywhere, but it isn't. As I was sitting in the waiting area, and I was really surprised. I saw nurses and cleaners and people pushing trolleys and things who weren't wearing masks. I was sitting down and they were walking close to me. The person pushing the trolleys would have been breathing heavily, and masks are supposed to stop the aerosols that were spreading around. I was shocked. It was a few weeks ago, and now with lockdown things are much tighter, and I'm sure the hospital has improved. I've had several appointments with doctors over the last 6 months using Zoom, and they've been very successful. I was asked to go to the hospital, and I imagined I would have a sort of richer experience and more tests and prods and things, but in fact, I and the consultant sat about 6 feet apart. He was wearing a mask, I was wearing a mask, and as it happened, nothing happened in that encounter that couldn't have been done better over Zoom. There were risks for everybody. I got close to people who weren't wearing masks, and it was potentially a risky experience, which was unnecessary.
So that's maybe part of the arts in health that you don't really see, because that's something that we're doing internally. We're using the arts to help improve the service. And it's something that I'm massively committed to. And I just want to say that this has become a bit of a flagship project for us, and it's being scaled up across the UK and internationally as well. So in Swansea Bay Health Board, stories are used at the beginnings of all meetings. Our policy is to make stories which lead to action plans and service improvement, although we do tell good stories as well, and lots of patients' feedback, lots of good stuff. We've got a SharePoint site with a library of over 200 stories, and we run a master's level accredited training for frontline staff to become story facilitators. And that training is now being delivered across the UK from Swansea Health Board. It's also becoming an all Wales policy that this is going to be our major way of collecting patient feedback. So it's a lovely example of an arts project which has scaled up because it started by listening to what health really needed and what health understood. So, and what's important to health. So I just want to share a few more things that are happening in Swansea Health Board to give you the whole range. We have 2 people who work on heritage projects. Here they are with a Wonder Karma, which was a pop-up exhibition around our hospitals with heritage things. And the poster on the left is from a big project they did on our mental health asylum, which was closing down. We now have a new social prescribing project, and I saw that Sian Parker-Martin is on the webinar. So hi, Sian, she's one of our social prescribers, and she's working with Johan here on the left, who is our social prescribing manager for the health board. And the Rengarific poster, that's one of the projects that is starting in April to help people in tier 0 and tier 1 mental health with their well-being. Also, as part of the social prescribing agenda, we have a big falls prevention project through dance. We work with ESOP on their Dance to Health program, and we've just got funding to start 12 more groups across the health board area. And just to say, if you don't know that program, it's a very exciting program. Falls is one of the big priorities for health. So this program takes professional dancers and teaches them the same program that physios do for falls prevention, and then they translate it into dance and run it as local dance groups, which really have shown a massive improvement, a 58% reduction in falls for people as part of these dance to health groups. Staff wellbeing, Jane mentioned earlier that we work with Clod Ensemble. This photo is part of a year-long project they ran with us on mental wellbeing for staff in our elderly mental health wards. And they're currently helping us with an ongoing program on staff wellbeing days that we're running. We also have newly appointed, and I've put Yori's picture there, music facilitator who's going to be leading on lots of in-ward activity. Obviously, at the moment, it's through electronic means. We can't actually have musicians sitting by people's beds as in the picture, but he's busy with lots of iPads and working with staff to get artists into the ward situations. One of the things we're interested in is doing an evaluation on that, because we employ lots of people in health to do what's called enhanced care, that's one-to-one care. And we want to know whether employing artists would be more beneficial than employing healthcare assistants, to have an artist on the ward all day, every day, as part of the team. It'd be quite an exciting thought. We also have projects like this one, which is Reading Friends. This is a bunch of students from our local university, and they came and were trained to use literature to sit down and read with people and share stories with people and reduce loneliness on the wards. So this is our team, and I put Johan's and Yori's pictures in because they've both started since lockdown started, so they're not in this picture, but so there are now 7 of us, all part-time, all artists, all full of energy and enthusiasm, as you can see. And I just wanted to finish by saying that growing the garden in health is great fun, but we're also here to be a bridge for you in the wider arts community. And there's a couple of specific things that I'd like you to see us as being useful for. We can give you insights into what the health board priorities are. So if you've got a project that you're running, we can help you see where it fitted, or if it did fit, or if it doesn't fit, because listening to health and starting with their priorities is absolutely essential if we're going to be successful. And the second thing we can do is, when you have a project, we can link you with patient groups and staff in particular areas and help be that bridge that helps your project reach the people that you're wanting to reach. So do contact us and use us, and we'd love to work with you and support you in developing more things for benefiting people who live across Wales. Thank you.
Thank you, Prue. That was really inspiring, really inspiring. And of course, when you say contact us, you know, Swansea Bay, contact Prue, but for those in other areas of Wales, there are 6 other health boards who will be able to plug you into that kind of local regional information. And I think, I mean, that was so many inspiring stories there, but I think one thing that I certainly heard echo through all of them, I think, is how in listening to the needs of health and the needs of individuals and enabling the telling of stories, the arts is an active part of that shift from the medical model of healthcare into a more integrated and person-centered model of caring. So thank you for that, really inspiring, and I'm sure really, really useful. I would like to finally invite our last speaker, Sarah Goody, who is, I think, going to offer some more practical advice for those of you who might be wanting to deepen your practice in this area of work. Sarah, I will hand over to you.
Well, good morning and nearly good afternoon, everybody. It's a pleasure to be invited to join this panel alongside such amazing projects and examples, I think, of what arts and health can look like. So I've got a quick presentation that's designed to look at some of the pathways into practice. So these are ideas about how you, as an artist, primarily thinking about the artist today, can look at working in arts, health and wellbeing. So what skills do I need? And I think when I reflected on this, I'm an arts practitioner and I work as an arts development manager for the health board. So I get the opportunity to see both sides. I think as an artist, I put down essential and desirable in thinking about work terms. But I think it's really important that you enjoy working with people and enabling their creativity. And that isn't necessarily everybody. So it's important to be realistic about where you want your creativity and how you like to deliver it. Because one of my experiences as an arts practitioner and also working within the health board is that the impact that positive that ownership over creativity has on our own health is really important. So really thinking about that. Also, and I think the last year has shown all of us an adaptable skills base and confidence to try new things. And it may be that you see yourself as a visual artist, but there may be multimedia projects or projects that involve music, time-based media or performance, that actually the crossover there is really valuable. So think about trying new things. And in terms of delivery methods, I think again, the last year has shown us how agile and adaptable we need to be in terms of practitioners to be able to work face-to-face with people and work remotely, and to try and work out what that essential spark is that we're trying to share with people and find different ways of sharing it. And I've also added a healthy self-employed toolbox, so that if you're coming into this sector as a self-employed artist, that you're aware of some of the things that can really bolster yourself as an employee. Desirable, I thought in our current conditions, looking at a lot of the work that we may be asked to undertake is think about mental health awareness and first aid training, and potentially trauma awareness. Now, there are online training courses available for these, and third sector organisations such as Mind will be offering them, in that giving yourself the opportunity to feel confident working with certain, with all client groups, and be aware that we may not get the opportunity to meet everybody in the room or the project to the degree that we'd like to, but to give ourselves the opportunity to be as confident in whatever may happen next. Good self-organisation. I'm going to skip through this quite quickly because we're a little short on time, but this can be available straight afterwards. I would also say that, and I think hopefully I've popped it in the chat, if not, I'm sure somebody else can, that I was lucky enough to work with Prue and a number of colleagues across Wales on the Artists and Hospitals Toolkit, which is still available from the Artworks Cymru website. And this was a large piece of work looking at how we told the story of how artists and creative people could work with health boards, and some information about health boards and how they work. Now, this work is a few years ago now, but I think in terms of a really useful document and things to think about when you're skilling yourself up working in that type of thing. So you can also look at a more recognised learning route, and I'm featuring in my bullet points information about my local geography, which is South Wales, but there are all of these options will be available with other learning institutions and organisations. So at University of South Wales at the moment, they offer a BA in Creative and Therapeutic Arts, which would give the opportunity for students, especially all throughout the years, for placement work and ways of looking at their own practice and how that fits into an arts, health and wellbeing context. BMA arts practice in arts, health and wellbeing, and I know we've got some students studying that in the room with us today. And also something that was touched upon earlier in Prue's delivery and also in Jane's is looking at the different context of arts as a therapeutic discipline, which is something that's regulated by the Health and Care Professions Council. So that would be working with your creative art form, but as part of patient outcomes. So it's a protected profession, and it's a slightly different pathway, but it's still as valid. In terms like professional development, events like today, absolutely are great places to think about where you might take your practice in this context. And there are other UK-wide arts and health networks which offer conferences, events and online training. And I've mentioned here Arts and Health Southwest, and there's a London Arts and Health Forum as well. But both of those particularly, and there are others, look at arts and health across the UK, so they're really useful. In terms of volunteering and placements, think about, if you want to find out more about how your practice might adapt into arts, health and wellbeing, is look at what's available around you. If you get the opportunity to volunteer, you would most likely be able to learn from the lead practitioner and then do some trial and pilot work with your own ideas, techniques and methods. A placement is usually organised by a parent organisation or a higher education course that may embed you in a health setting, and also offered with supervision. And this supervision and reflective practice, which will come up very quickly in a minute, is a way of having support and peer mentor support, so that you get the opportunity to discuss your work, how it's going, and raise any issues that might come up. And there is a wealth of third sector organisations working in arts, health and wellbeing, either specifically or beginning to look at it as part of their main delivery. So locally to me, Head for Arts, Inside Out Cymru, Music and Hospitals and Care work across Wales and across the UK as well, just to name but three. There are several organisations, and I think the awareness of how important the Wellbeing of Future Generations Act, local authority interests and the health boards all recognise the importance of our health and wellbeing, and being able to offer support in kind or directly for that gives third sector organisations the confidence to be able to expand their programmes into looking at specific arts, health and wellbeing projects, which may then offer opportunity for artists. So very, very briefly, looking at commissions and jobs. Now, it's a piece of string exercise in terms of scale. So I would always recommend joining the mailing list of organisations who you're interested in working with, because they will often advertise directly to their mailing list first and promote locally before sharing wider. The Arts Council of Wales website often carries many opportunities. The Arts Council of England Arts Jobs Service also carries opportunities that are relevant to Wales as well. And the next on the list is Sell to Wales, which is generally for large commissions for public sector organisations. So this is a way that the procurement system that public sector organisations have to advertise their opportunities. So it would normally be looking at commissions, and if I'm talking about commissions in this sense, it may be very well environmental art, as was highlighted earlier. Often there may be residencies available, but it depends on who is direct commissioning. So it's good to look at Sell to Wales and try and get your head around it, just in case one of the opportunities you're interested in is only available through that. Artist Newsletter is an amazing resource, and also can offer public liability insurance, which if you're a self-employed practitioner is always worth keeping up to date. I would also keep an eye on funding opportunities that arise. I've mentioned the Arts Council of Wales here, and Nesta and the HARP scheme. When and if new funding is announced, then there may often be briefing events that will explain more about how you may be able to apply for that funding and take an opportunity, which will also offer an opportunity to network across the sector and see who else is thinking the same thing that you are. And is there something that you can do together? Because I think my last point is take a risk and partner up, is look across and who else is interested in working in the way that you are. And there may be more opportunities available for you to work together and take something forward on something. So I'm aware I've been talking very quickly, and I hope this has been useful to you. But I'm very happy to take any questions as they arise now this afternoon, and I can make my email available. So thank you very much for your time.
Thank you, Sarah, for that wealth of tools, advice, and signposting. I feel like we've tried to map the terrain. We've tried to kind of look at the hills and the valleys and map the terrain, and we've tried to find some pathways through it. I love, Prue, your notion that that your role is as a gardener, and I like the idea that Sarah perhaps has just given us some tools to enter into the landscape, to enter into the garden, whether they're boots or maybe a compass or a map or a trowel. So hopefully you feel enthused, inspired, but also equipped to think about where next and where you want to go. We've now got a little bit of time and a panel of really experienced people here to take any questions. And I know there have been some shared in the Q&A, and I'm just trying to have a quick look there. Let's have a see. There is one about signposting to art therapies and to social prescribing. I think it's very difficult to signpost to specifically to art therapy support. If you want to access it through the NHS, I think you would have to go through initially through your GP. If you are wanting to pay for it yourself, there are various art therapists who work privately, but I wouldn't want to signpost other than say the GP would be the first point of call to access that. And in terms of social prescribing or arts on prescription, again, I think probably the GP in most places would be the first point of call, or to look through various charities supporting different aspects of well-being. But I think that question is maybe if you're a practitioner and are wanting, rather than a patient, and wanting to build those connections. As Prue said, the arts managers, the arts coordinators in the health boards are really there to offer you those links, those connections, and to act as a bridge. I don't know if anybody else wants to add to that. Sarah?
Yeah, in terms of social prescription or arts on prescription, there is a research group, the Welsh School of Social Prescription Research, which has been very active in the last year, trying to determine what best practice looks like in social prescription. And I'm aware that there is also Wales-wide arts on prescription interest group as well. So a bit of Google and people will be able to find access to information from the practitioner side of social prescription.
Great. And Prue?
And I didn't realise that our Arts on Prescription manager is on this webinar. So he's put his email in the chat, so you can contact him and ask questions too.
Great. Thank you. Thank you. Somebody was asking about signposting to research as well. And they missed part of mine, and they're saying, did I mention any other research? I haven't gone into any depth or detail around research. The only research report other than the Arts Council Wales mapping report that I mentioned is the Daisy Fancour's World Health Organization evidence review. But again, there are research networks, and I mean the Arts Health Research Repository, we can put a link to that in the chat. But Sarah or Prue, where would you send people to if they want to find out more about the evidence base for this work?
Well, the WAHWN website is building a really good collection of case studies and evidence and reports specific to Wales, which is really helpful. And then other similar websites will like Arts and Health Southwest that Sarah mentioned, have a wider collection. But Wales, the WAHWN website is a really good resource at the moment.
And Sarah, you mentioned the social prescribing research network as well, which if you want to know more about that might be a good first point of call. Are there any other questions from people? Is somebody asking about, in England where we don't have health boards, how would somebody contact the equivalent of you, Prue, or you, Sarah? And I think I mentioned in the chat, it very much depends where you are, but most of the NHS trusts in England now, well, not most, but many of them have arts programs and have arts managers responsible for those programs that would play a very similar role to Sarah and Prue's. So maybe the London Arts and Health Network or the Arts and Health Southwest would be good first points of call to find out who's in your area. Or just to contact your local hospital and ask that question.
Ask for your ask the patient experience lead. Might be the person who would help.
Good idea. Thanks, Prue. That's very helpful. Any other questions or comments from people?
Whilst we wait for them, Jane, I'll just say that Sarah mentioned the artist's handbook that she and I and a few other people worked on. So I do have some hard copies of it. If people, they did cost a bit to print, so they're £10. But if anybody wants one, it was specifically the area of working in hospitals, not sort of more generally. But we felt that that was an area that people might want to get some specific information on. So there's some copies of this available. People contact me.
Great, thank you, Prue, for signposting to that. And yes, as you said, the Wales Arts Health Wellbeing Network is a key place for you to go for a whole range of things. So future networking events, future training events, case studies of practice, links to the evidence base, and a whole host of films and other really useful resources, as well as a way of contacting each other and building a sense of community, looking for ways to develop partnerships to develop work. Yeah, do sign up and join if you're not members already. So I can't see any other questions appearing in the chat or the Q&A. So I think probably if there are no further questions, it is 12 o'clock now. I might just end by saying a massive thank you to my co-presenters, Nesta, who's had to leave us, but thank you to Nesta, and to Sarah Lord from Age Cymru, and to Prue Thimbleby from Swansea Bay Health Board, and to Sarah Goody from Garth and Anayam Bethin Health Board. And also Angela, thank you to you and to WAHWN for organising and making this event happen.
And thank you very much, Jane, for kind of bringing it all together as well in a kind of useful, coherent and valuable way. So thank you very much. And thank you to Tracy for supporting the event as well. And just to remind everybody that we have recorded the webinar, and all our contributors have said that they can share the resources that they've shared today. So I'll shortly be able to share all of them. And just a final reminder, if you haven't already, to sign up to WAHWN and make the most of the resources and networking and training, etc., that we're able to share regularly now. And to thank the Arts Council of Wales, of course, for supporting the event. And great to see you all. Thank you.
Thank you, everybody. Goodbye.